need some comment about that. Okay, let's go. How are you?
Good afternoon, Madam Chair, Senators, Representatives. Thank you for the opportunity for me to address you this afternoon. My name is Usha Tiwari, and I'm a volunteer ambassador for the Alzheimer's Association of Central and North Florida chapter. Alzheimer's disease is the only top 10 leading cause of death in our country without a prevention, treatment, or cure. It ranks as the 6th leading cause of death in America, as well as the 6th leading cause of death in Florida. Currently, there are more than 5.8 million Americans living with Alzheimer's disease, and someone is developing this disease every 65 seconds in our state of Florida. In our state of Florida, there are more than 500,000 Floridians presently diagnosed. This makes our state the 2nd highest in prevalence and ground zero for this healthcare tsunami. In Orange County alone, there are just over 16,600 people and their families living with Alzheimer's. Given our state's prevalence, it is likely that everyone in this room may be either personally affected by this horrible disease or knows someone who is. With that in mind, the Alzheimer's Association would like to work with you this year on the following agenda. First, establish a dementia coordinator within the Department of Elder Affairs to facilitate support and coordinate state programs and policies related to Alzheimer's and other forms of dementia. 2, to provide protection against elder abuse and exploitation by passing vulnerable investor legislation. Number 3, to ensure care facilities are providing the most cost-effective and updated training programs for employees who interact with and care for people living with Alzheimer's disease. 4, funding for the Brain Bus program, which is a mobile outreach program that offers early detection and awareness education and other resources specifically to diverse and underprivileged communities throughout our state. Number 5, to increase for respite services and other Alzheimer's initiatives to assist the 1.2 million caregivers like me in Florida. And finally, number 6, to increase funding for the Ed and Ethel Moore Alzheimer's Research Program in Florida, because we understand research is fundamental and the most direct path to finding a cure. With Alzheimer's associations ask for your support, they are able to support and educate your constituents all free of charge. They have a 24/7 confidential helpline that I use personally myself as a caregiver that provides critical services and is manned by dementia specialists 365 days a year. On behalf of the Central and North Florida chapter of the Alzheimer's Association and Floridians diagnosed with Alzheimer's and family caregivers, I thank you once again for your service and ongoing support.
Anyone here? Okay, Representative Escamani would like to have a say.
Thank you, Chair Stewart. Usha, thank you for your leadership and for lifting up a really important issue. And I also just want to highlight the points you made about being a caregiver. And I think that sometimes we forget that a disease like Alzheimer's, something like cancer, impacts not just that individual patient, but the entire ecosystem around them. And we met with a caregiver in our district recently who's 19 years old, caregiver for her grandmother, who really is her mother, and just struggling to survive as a caregiver and the stress and trauma that caregivers experience. So I know that there are some nonprofits, helping provide this support, but thinking about the larger ecosystem around caregivers, so please let us know what we can do better to ensure that you have the support you need to take care of your loved one.
That's good. And I really appreciate this. Like I said, I work full time and juggle taking care of my mom and involved in the community. So it is a monumental task, and it's one of those silent segments of our population that needs their voices heard. So thank you so much.
No, it's an honor. And I'll add to that. Many women are going to be caregivers of their seniors and of their children. So in some cases, folks are really playing, that double duty shift. So we really do care deeply about it and want to support you.
Thank you.
All righty. Thank you very much.